Yep.
Alright. Hey guys, what's up? This is Brad with Spike Fitness, and want to get a quick video in with my buddy Dr. Joel Tate, who owns Progressive Chiropractic and Rehabilitation here in Crestview, Florida. And so I talked before about building up a team and having people behind you to kind of support you and make sure that you function at as high a level as you possibly can. And we shot a video with Dr. Nate, and so I wanted to take an opportunity to introduce you to Dr. Tate. So this is Dr. Tate, and he and I have been working together for about 2 years.
About 2 years now.
And so initially I came to see him because I was having some mid-back issues. Benching for me tends to put a lot of strain on my back, just because trying to get in a position and lock it in tends to be problematic for me. So I was having some mid-back issues, kind of the CT junction, and kind of come to him to kind of help me through it. I found him on the internet, and just looking for local reviews of a chiropractor that people seem to like, and he came highly recommended, and so came in, started getting treated, and then obviously got along with him, and kind of here we are. So wanted to do a video here to kind of introduce him, and then kind of go through some treatment for me. So what we're going to do here is yesterday, while I was squatting, putting the weight back in the rack, kind of bent my arm back a little bit, and I ended up straining the origin of the insertion of my brachialis. It's not a super bad deal, but it's just kind of painful. So I've been getting a little bit of treatment on it, and so we're going to do some stuff to kind of help treat that as well. So what are we working on today?
Today what we're going to do a combo and muscle stem, muscle stem and ultrasound combination therapy. We're going to start with one pad down here, one pad down here. We're going to get an electric current running through that brachialis. Then I'm going to put some ultrasound gel right here through the elbow, right towards the insertion of that muscle, and do some deep heating. So what we're going to get is inevitably some passive muscle contraction while deep heating at the same time to alleviate some pain and heat that muscle from the inside out.
Cool. So this is something that we've done, kind of here and there on different issues that I had. We've had to do it. We did a bit on my clavicle before, and we've done it on a few spots in my back here and there. So this isn't something that I do all the time. But if I have a kind of a chronic or acute, not a chronic, but if I have an acute issue, this is something that we've done to kind of help alleviate some of the discomfort from the acute problems that I've had. Last year, while doing some work, prep work, trying to get ready for USPA Nationals, I had an issue with my my clavicle, and I think what we kind of determined that I had done is subluxated my first rib, and then also kind of strained the sternoclavicular joint. And so it caused me quite a lot of discomfort. I wasn't able to bench, wasn't really able to train very effectively there for a few weeks. And so one of the things that I had done is come in and see Dr. Tate quite a lot to kind of get some work on that, see if we could get the first rib back into position, and then just doing some work to try to alleviate the issue with the sternoclavicular joint. And so this is one of the techniques that we utilize, is some of the electrostem and then some of the ultrasound, and that combined with using the boom stick, some how do we call that? It's like
Manual therapy or trigger point therapy. We really use the combo therapy to relax the trapezius and some of the levator scap and upper rhomboids, there where the first rib comes in, right there under the trap. During injury, you get a lot of inflammation and irritation, so that
muscle
trap
guarding
seems to guard a lot. The biggest thing with chiropractic is looking at someone who is as muscular as Brad is. You've got muscular attachments to all of these spinal segments, so if there is some contraction or guarding, those muscles will physically yank or pull on the structures they're attached to. In this case being the CT junction, It was a little bit of a battle last year trying to fight that, just because it was a very tough injury to pinpoint um, really what we did. So upon our diagnosis, it was more of a lack of everything else being affected to kind of rule in the first rib subluxation and just the chronicity of it coming out during his workouts on a daily basis.
Yeah, so that was there was something that kind of sidelined the training for a couple of weeks. In fact, there was a point where I wasn't.
Down your bench a lot.
Yeah, I wasn't sure if I'd even be able to compete. There was no way I wasn't going to go. That was never an option. But for a while, I was afraid that I was going to have to go and take a token bench, just so I could show up and say that I went, basically. As it worked out, we were able to, treat it enough where the issue healed. I was able to do a little bit of bench training before nationals, and actually ended up hitting a PR before going out to nationals. So I was quite pleased with the amount of work that we got done and the recovery that I'd had. And so that kind of goes back into me just talking about the importance of recovery. When I was being almost 35 now, when I was younger, I never paid any attention to recovery and rehabilitation. I was just kind of go all the time. And if that's something that I can impart to any young, newer lifters, people that are looking to try to get into it, is really the game's all about longevity. And you can ensure longevity by properly rehabilitating and having people in your corner that can help you out and help you take care of different muscular issues that you have. And chiropractic is something that I absolutely recommend. I've had a lot of success with chiropractic treatment, kind of keeping me up and functioning. And as I've said, for me at least, benching is kind of one of the hardest things that I put myself through in terms of my spine. So a lot of times I have mid-back issues, in the thoracic area of my spine, just because of trying to get kind of contorted into position and having everything locked in. It tends to kind of cause issues with me from time to time. So as part of my continuing efforts for physical therapy and just kind of making sure that I'm keeping myself functioning, Dr. Tate does a great job of taking care of me and getting me in, helping me get properly aligned so that I can keep training at as high a level as I possibly can.
Fred makes a good point with all that too. He says that even with the sheer volume and of mass that he is putting up on a daily basis, spreading it out evenly and having a very good routine on top of daily treatments, whether it be at the PT room or here at the office for chiropractic and some electric modalities. Doing that is going to keep the body at its most optimal level. I can't tell you the amount of times I've seen younger athletes come in here at the end of the season after they're just worn out day in, day out, and just hindered by the same incident or the same injury, really, whether it be an alignment issue or a chronic straining muscle issue, usually associated with habits of the injury or of the activity, or whether it be a normal alignment issue that leads to a muscular issue as well. Musculoskeletal system is a system that you can't have one without the other, so taking care of both of them is definitely going to keep your keep your performance on its top notch. As you can see, we're getting some fasciculation here. The head of the ultrasound wand actually acts as the third pad, so we get a little bit more intensity of the electric current on some of these points, and those spots where, right in here, where you're getting those trigger points stimulated, we're causing that muscular contraction. Probably right where that insertion is.
Yeah, I can feel it too. It's like right when it happened, I felt the pressure and I was like, that didn't feel right. All right, so this is one technique that we use for some of my muscular issues. And especially with the back, as large as the muscle groups are that are in the back, you can imagine how, as those muscles get kind of hypertonic and start to pull, how it can pull things out of alignment and cause issues with the spine. So I think we're going to reset and do a quick adjustment, just kind of show the adjustment for me and kind of what I go through, and talk a little bit about what other athletes experience as well.
Sounds good.
So, all right, so we moved into the adjustment room and got you set up over here so we can kind of look down and you can get a view of what Dr. Tate does for me for some treatment. And again, I can't say enough positive stuff about chiropractic care in general. I found Dr. Tate from the internet, but after having come with him for like a session or two, obviously I got along with him personally. So having a good relationship with your chiropractor is important. Having somebody that's going to kind of support your efforts and help you maintain the style of life that you want to live, I think is important too. One thing that Dr. Tate has never told me is to stop doing the things that I want to do or try to give any of that up. And so, he kind of helps do what he can do to, enable me to kind of chase the style of life that I want to live. And right now that's powerlifting. So, finding a good chiropractor, finding somebody that you get along with, finding somebody that will accept ideas and things like, I introduced the boomstick. That's, a tool that Kabuki Strength developed in conjunction with Donnie Thompson. And we've talked about that. I have another video that kind of touches on some of that stuff. But I introduced the boomstick to Dr. Tate, and that's something that he implemented into my chiropractic care as well. Would use that to kind of help get those tonic muscles to relax a bit, and so that we could achieve adjustment a little bit more easily.
Okay.
So where are we going?
I want you to start face down.
Okay.
Briefly, quick anatomy. The nervous system is encapsulated. It's the only organ system in the body which is encapsulated by bone. So we start with the brain, which is wrapped by the skull. We go down, starts with the spinal cord, which is encased in between the bony structures of the spinal column. So with that being said, the alignment of the bony structures is going to prevent the nervous system from having any insufficiencies in doing its job. Now with a person like Brad, as we talked earlier, when he gets a muscle, and this is his area right here, the trap starts up here, comes out and down, and then back to a big diamond shape all the way across the upper back. That trap gets really agitated as it pulls on these muscles of the what they call the cervical thoracic junction. If they pull it out of line, he's going to get some irritation or some nerve interference with the nerves that exit there at the CT junction. So he could have a decreased function, he could have increased pain, or decreased sensory function, or all of the above. So in order to do that, we want to make sure that these muscles are not hypertonic as we see on a daily basis with him. This just happens to be his chronic area. As the patient is right-handed, sometimes we have some imbalances just due to habit, whether it be from the line of work, daily skills, daily habits, and requirements to fulfill one's work.
Certain proclivities.
So we go through here. What I like to do is always start from the bottom and work my way to the top. So I'm going to start by stretching him out a little bit. This table flexes and distracts. Get a little bit of opening up on the lower spine. Brad has occasional problems with the hip. Nothing terrible unless he again adds too much weight before he should. But normally he knows when it's out. He comes and takes care of it right away. More of a hip and pelvis issue versus a spine problem, but as the body is one kinetic chain, you have to have all of them working properly to get the best function. Not too bad there, buddy. This table also has a drop section, meaning I set the tension just enough to support the patient's weight. I'm going to come in, contact PSI is here. We're going to go towards his feet. The act of his body falling and stopping abruptly in the direction I'm pushing is where the adjustment's actually made. I'm using the leg length to tell me what's going on with the hips. If the hips are forward or back or up or down, you're going to get a difference in the leg length. This side appeared shorter earlier. After that quick adjustment, looks like they're back. Again, like I said, he never really has too big of a problem here. Back up just a little bit on table. Also, I want to note, Brad did get adjusted yesterday. Was it yesterday?
Yeah.
So, probably not going to see too much here today. It should make my job a little bit easier than it was yesterday. Quick breath. The right side here, what we're working on is those first ribs, where they attach out here on the transverse processes and come right up under the scapula, connect down here to the sternum. Actually, I take that back. They don't actually connect. They connect via cartilage, not actually a bony junction. This left side always, like I said, as I say that, usually easier. Not too much today, but so with that adjustment yesterday, come back up. There we go. Good release on that. So let's try this one again.
Get aggressive. There you go.
You go?
Yep.
Good. Yeah, not terrible today.
That's good.
Yeah. Flip over.
There it goes. What are you doing here?
Here we're just trying to make sure that we've got accurate motion from all the cervical vertebrae. So I'm applying just a little bit of leftward rotation and making sure that we've got good motion between each and every cervical vertebrae. If we don't, we just give it a little thrust to break up that fixation. One more time.
There it goes.
Again, with Brad's sheer mass, he is always keeping me on my toes and making sure I'm at the top of my game to be able to physically manipulate his body, and usually gets me sweating in the process. So
Takes a lot to get you moving.
yes, it does.
All right, guys. I want to make a quick video. Do you think that covers everything we did
I
today?
think it was a good start. Yeah.
I just want to make a quick video, kind of again touch on another member of kind of like the team that I go to kind of keep me running. It's something that has made a big difference for me in kind of getting back into powerlifting after having taken a long break. It's something that I found has made a tremendous difference in my athletic performance, but then also my day-to-day life. You know, I like I said, among all the things that I do, I don't know if I could recommend chiropractic care any higher. It's really become a facet of what keeps me going. It's not something that I need every single day. You know, as Dr. Tate talked about, you know, when I have an issue, I come in and get seen. So it's not something I need every day, but when I do need it, it's really the only thing that's going to make the difference for me. It is what I need to correct whatever issues that I have. So if you guys are in the Northwest Florida area, you know, come see Dr. Tate. He owns Progressive Chiropractic and Rehabilitation, and you know, I'll splash up his his information here at the end of the video as well. If you've noticed it, it sits on the front of every one of my videos because, like I said, he's critical and crucial to what I do. So I just want to make sure I took a moment to introduce him so you guys can kind of see what I do to keep myself up and running, so that maybe you can consider that for yourself. That's all we got for today. Just remember, guys, no matter what your goals are, no matter what you think you can't do, train despite.
Thanks, guys. See ya.